All right, welcome to the Mint Condition Podcast. I'm Brad Clementson, and today we've got a guest with us, Dr. Jeff Clayton. Thanks for joining us.
Yeah, thanks for having me.
So Dr. Jeff Clayton is a chiropractor in the Ogden area. Ogden, Davis County, Weber?
Yeah, Weber County, South
County.
Ogden.
Nice. It's a good area. Dr. Clayton's one of the top experts in this area. You do a lot with personal injuries, car crashes. You've got your own podcast and help educate the public. So we're excited to learn from you today.
Well, thanks for having me.
Yeah.
Hopefully you learned something.
Well, I think we will.
Yeah.
Do you mind starting with, tell us your background. How'd you get into chiropractic school or interested in becoming a chiropractor?
Okay, yeah, my dad was a chiropractor, and growing up I was never really interested in being a chiropractor. I guess I didn't want to go that route, and
Yeah.
I graduated from Weber States with a communication degree, and I played in a band and liked recording music and wanted to maybe do advertising or something, and then I just started looking for careers and jobs, and nothing was working out. And one day, I don't know what made me think of it, but I thought about my dad and how many people he was able to help and, you know, support a family and make a difference, and it just kind of stuck with me and made me want to do that. So then I was 29 at that time. I felt pretty old, but then I started chiropractic school and have not regretted it.
Yeah, I think especially when we're younger, it's hard because you're like, I'm 29, man, I'm so far. I should have started that before. But my favorite example is KFC. He was like 62 when he started it, right?
Yeah.
My grandpa was 73 when he started his own pancake business, and it blew up. It's huge. I think it's All Street Grains. It's a pancake brand out there. And
I'll have to try it.
It doesn't matter what age we start at, right? And I think anywhere where you're at, you can take a left turn, right turn, and start on a new path. So that's cool. Where'd you go to school?
I went to the University of Western States up in Portland.
Cool. Do you like that program? Was it heavy focused on research? What made it unique?
You know, it was pretty focused on the what do they call it? Evidence-based practice and all the research and looking into a lot of that. And at the time, I don't know if it's the same now, but they had the highest pass rate of national boards. And you know, you got to pass, so that seemed pretty good.
That's
and
pretty important.
You know, different locations to live. Portland was close to home for family, and weather seemed kind of nice, so that's where we went.
That's awesome.
Yeah.
So after you graduate, did you move straight to Utah and start working?
Yeah, I moved right back here and just kind of opened a clinic and started doing this.
You opened your own, like right out of school?
I did share space with two other chiropractors. I was with my dad and another chiropractor for a few years, and then they retired and just kind of did my own thing from there.
That's cool. I love that. A lot of chiropractors tend to open their own businesses, which I think is great. PTs don't. Have you had any thoughts on that? Like, why are PTs more scared to do that?
Well, I don't know. I mean, it's not just PTs, medical doctors, very rare that they graduate and think, I'm going to open my own clinic and do things. We were talking about Kevin Mangum, who's the DO in Murray. He worked for another clinic for a couple of years and then opened his own. And I think he said if he wasn't a chiropractor initially, he probably wouldn't have done that because he didn't think about being a business owner in healthcare. But I think a lot of people don't want to be a business owner and a healthcare provider because now that you have two jobs instead of one. So
has that been difficult for you to do both?
Sure. I mean, there's a lot of behind the scenes running a business that isn't fun and you don't want to do, but you got to get it. Yeah, it's just part of it. But I don't know. I like having my own thing, being your own boss, doing that.
Then you get to practice your way. You don't have anybody saying you got to build this unit or see 3 or 4 or 5, 10 people an hour.
Yeah, or say how they want you to manage patient care, and you know, you get to just do it your way. Yeah.
So if you were talking to any chiropractic student or somebody headed into chiropractic school, would you suggest they start their own business?
Yeah, I mean, I don't think there's a lot of other options in the chiropractic profession. There's not a lot of people hiring, and those that hire are not paying very well. You know, medical doctors can get a job out of school paying well. And I don't know about physical therapists, but probably better. My profession's not great at getting hired on. You'll be taken advantage of. But
which is interesting.
How many years do you need on your own doing your business before you make money? I was about 3 years before I was making any money. So it's not easy.
Neither route is easy, but there's pros and cons to each, right?
Yeah.
I think it ends up being worth it. Start your own thing. The first couple of years are going to be hard, but rather that than be stuck making pennies, right?
Yeah.
I don't know what chiropractors make, but in general, PTs are making about 75, 80,000 out of school. As
Being hired on.
Yeah.
I would doubt many chiropractors could get that out of school.
Really?
Yeah, I don't know. I didn't go that route. I know a lot of people that didn't make any money, ended up leaving. It didn't go good for them.
Right.
So
I think that's interesting. I think PTs and chiros should be educated about that more before they go to school. Like, hey, if you're going into this program, you kind of need to plan on owning your own business if you're going to make any money, right?
yeah, I think they set a lot of people up for failure because they don't realize that they think they're going to be a doctor,
Right.
doctor of chiropractic, doctor of physical therapy, and that you'll graduate and the money and jobs will just come to you and you'll be living it up. But I don't think it's set up that way in the real world.
Right. Well, I think it's super helpful on podcasts like this for somebody experienced. How long have you been a chiropractor?
Just over 13 years.
Okay. So somebody 13 years in can tell a chiropractor, like, hey, you got to plan on this. Like the chiropractic students I talk to a lot of PT students. They'll call, ask for hours or whatever. And I'm like, more than hours, just come talk to me. Like, you need some advice. That's not common enough. People don't talk to, I want to be a plumber. Go talk to a plumber. Like, well, no, I'll talk to this plumbing school. Their job is to make you a plumber and sell you on it. Same thing with chiropractic school. I think people need to interview chiros, PTs before going that route. Really learn, what does it take? What is the job like, on all sides of it.
Yeah, I think maybe physical therapy is the same, but in chiropractic, we're way different from medical doctors, and the biggest difference is residency.
Yeah.
We graduate and I just got my license right away and opened my door, where a medical doctor will graduate, then they'll go do 2, 3, 4, 8 years, whatever kind of residency they want to do. And that's where they get a lot of the real world experience. I think that's great. And so I think my profession would be better off doing something like that. Or maybe, like you're saying, just at least give them an opportunity to see what the real world's like. Because the schools are just there to sell you, to get you in the door. They want the money. And
well, they even tell us in PT school, our job is to get you to pass the board exam. Because all the time I was like, well, on this condition, what's the progression? What's our rehab program and plan? They're like, oh, that doesn't matter. You need to be able to answer ABC on a board exam. And knowing how to progress someone in an ACL rehab from phase 1 to phase 2 isn't part of the board exam.
yeah.
So they're very much invested in their pass rate.
Well,
right?
Academics is different than the real world.
Yeah,
And,
exactly.
I mean, I feel like it took a few years before I felt like I was ready to just see patients, even though I'd been seeing them all along, right? Just the experience you gain. And I sought out a lot of additional training throughout, the first few, I still do, but really hard the first few years to become the best, the best I could be. So
yeah, I think that's super important. We need to add on to it, all that training, but then keep fresh, right? Some of my previous employers and they'd say this, they're like, I'm stuck in my routine because it's comfortable and easy. They've been doing it for 30 years. So we've got to stay fresh, but experience pays off. Well, just to switch gears a little bit, in your practice, what is your general field? Are you treating only people who are in car crashes, or family practice? What do you do?
no, I do general chiropractic, but I definitely specialize in working with attorneys. So I'll do a lot of people that were in motor vehicle collisions, the workers' comp cases, and then I'll do a lot of expert work for attorneys, independent medical exams, impairment ratings, a lot of that stuff as well.
That's pretty advanced stuff, like well-rounded, but still specialized in that PI. I feel like a lot of chiropractors, especially younger ones, are afraid to get involved in PI cases or do IMEs. What made that easy for you to get into?
Well, I don't know if it was easy. The reality of business is a lot of personal injury and working with attorneys pays better than just general insurance. And so you see the money when you're starting out and you're like, hey, this is a path I'm interested in. But I learned really quick, if you're not an expert in the area, you really understand it, you're not going to excel in that. So I I spent a lot of time doing a lot of training a lot of it was in New York, but other places as well, working at the New York at Buffalo Medical School with different neurosurgeons, neuroradiologists, getting different credentials and training, MRIs and accident reconstruction and all sorts of different biomechanical injuries and ligament pathology to become an expert. Then once you are an expert, doing the personal injury work's a lot easier because you know exactly what you're talking about.
You can rely on your own base knowledge for that.
Yeah.
Just hearing you say all of that, I think half the PTs I've talked to would be blown away. Like there's too much, and it's gotten better, but there's too much of fighting between chiropractors and PTs in PT school telling you like chiropractors are quacks or whatever, right? I think if PTs got to just talk to you and hear you talk about the biomechanics and ligament laxity and those things, they'd realize how knowledgeable you are. What has been your experience? Have you been able to connect with physical therapies?
Not very well. I think there's, I don't know, a competitive issue in the middle, but what you were saying made me think of any profession. If you need your car worked on, good luck finding a good mechanic. They're out there,
right,
but there's a lot of shady ones. And
right,
same with chiropractors, physical therapists, medical doctors, dentists, you name it. You got to make sure you know who you're working with,
right.
Which is why I've been trying to reach out to physical therapists. Let me meet some. Let me see the work you do. Let's work together. And so it's been good so far working with you guys. And it's only been a couple months, but I think it'll be really good. But I think in any profession, I want people that are pushing themselves, that know what they're talking about. If we're going to go to court on a case, I need the physical therapist to back up what I'm saying and know it and understand it, or else, we're all testifying on different things and that doesn't work out.
Or not testifying at all.
Yeah.
Because I've met a lot of PTs and their knowledge stops at what passes the board exam, right? And you lose that over time too. So I agree with that. You got to find the right PT or chiropractor who's taken it to that next level, learns the ins and outs of real rehab and how the body really works. Because you can go to a physical therapist and be like, I had a total knee replacement. And most chiropractors, most monkeys could help you rehab a total knee, right? But to actually work on more complex things, or even with the total knee, taking it the whole way, it takes more. It takes somebody who's more passionate.
Well, I don't even know that it's the treatment that's an issue. I think most chiropractors are very confident and competent providers. They can treat people and get people better. I think the same with physical therapy. I think physical therapists can treat and get people feeling better. But can we document it? Can we show objective evidence of an injury that total knee replacement was caused by the motor vehicle collision for specific reasons and spell it out, and that we're all on the same page, that when I say someone has this injury and here's the pictures from the MRI, that a physical therapist can do that. Physical therapy in Utah, I don't know if it was this year or last year, but big changes. You guys are primary healthcare providers. That's great. We don't have to mess around with getting referrals. You guys should be ordering MRIs, and you should be looking at your own MRIs and knowing what you're seeing, and for the attorneys, putting it in reports, put a picture of the injury and explaining why they're new. Those are things that primary care providers need to do, but not just chiros, physical therapies, but medical doctors not doing a lot of that. Not a lot of them are looking at their own images and making sense of it.
They just read the report.
Yeah, which is wrong a lot of the time. It's very common to have a lot of mistakes and missed things.
Have you read the research on the MRI results? And it's like 9 out of 10 MRI readings will be different from each other.
I haven't read that, but there's a study I use a lot that shows, I think it was 51% of radiologists will misread spine MRI. And not that it's different than what they said, because MRIs are subjective. They're just opinions. You're looking at it, giving your opinion. But missing things, it was 50%, it was around 50% of the time they were missing disc herniations. They were missing disc bulges. They were saying right-sided stenosis when it was really on the left. So there's a lot of error in that. And so as most providers don't look at the images, I mean, surgeons do, because you're not going to cut someone open on someone else's opinion, but a lot of other providers are relying on that. So going to training with, I did a lot with Dr. Peister and Kevin Baker, who are neuroradiologists out at New York, so a lot of training with them, to know how to look at the MRIs so I can, better serve patients that way.
That's cool. I think that's extremely needed, because I've talked to other PTs. I've been ordering MRIs for like 6 years. The main thing is PTs are afraid. They're like, I don't know what I'm looking at. I'm like, how do you not know what? Go study it then, right? Like, you need to be a clinician, not a PT. PTs who are too afraid to order MRIs, document, support what they're doing, are technicians, not clinicians.
Yeah, same in my profession.
Yeah.
We have a lot of newer clinics. I won't mention names, but they're just come in, membership, get adjusted, leave. And they've taken the doctor out of chiropractic. They just want to be a technician, just adjust. And that doesn't mean it doesn't help people, but especially on injury cases, you need someone to do what you're saying.
Yeah, if you've got an injury case, you have to have that supported document. But even if you don't, and you're getting an adjustment without that documentation, what's the medical plan there? If you're like, it just feels good, maybe, but I don't know, even then I wouldn't do that. But there needs to be a progression, a plan to somebody's health. You only get one spine.
Yeah.
Do you really want to roll the dice and gamble with that?
Yeah, sure.
I don't know. That's kind of iffy. It's risking a lot. I don't know. I just can't understand somebody not wanting to be the clinician. But let's get back to the MRIs and reading MRIs. So when it comes to getting confidence for some of these younger clinicians, or even older ones who just haven't dove into that, what would you recommend? Where do they go get more training and learn how to read an MRI and get those results?
I mean, there's probably a lot of different places. Dr. Studens, a chiropractor in New York, he created a company. I think he calls it the Academy of Chiropractic. He has some good courses I've taken. His old partner was Bill Owens. He's a chiropractor out that way. He's created other courses. Those are great courses, and you get good credentials. They're usually credentialed through the medical college, which is really important, because if I'm going to go testify in court, I need to be certified as an expert. So I need the credentials. Yeah. So those are important things. But what I did at the beginning is take those courses, and then I would log in, and this is probably a HIPAA violation, but I'd log in to the different imaging centers I ordered from. And back in the day, I don't think King's Imaging is even around anymore, but I used to use them, and I could pull up any study they did, and I'd just pull them up, and I'd force myself to write down my report of that. And then I'd pull up the radiologist report and compare it.
That's cool.
And then I would shred the paper, whatever. And I didn't look at names or anything, but I would do that 1 or 2 times a day, just constantly getting that practice to see where I was at. But then now I'm looking at patients' MRIs probably about daily here, if not a couple times a day. And so I'm just constantly getting that. And I work with a lot of the radiologists, the ones that I refer to. I'll call them up if I have questions, and we'll review. And they're super friendly. I think radiologists sit in dark rooms and get kind of bored and don't get a lot of association with other people. So I think they enjoy a phone call and being able to explain it to me. Or sometimes I'll catch things they missed, and there's no ego involved. I just want to get on the same page, because I don't want to go to court with a radiologist report saying something and my report saying another thing.
Yeah. But that's the cool part. I love that you brought that up. Radiologists are humans, right? They make errors just like we do, and they are friendly just like we are. I've talked to several radiologists and just said, hey, could you recheck this thing for me? And sometimes I've been wrong, and they were like, no, I'm looking at this. This is why you're reading this wrong. And I'm like, well, that's their specialty. And I haven't done as much training as you. I tend to trust them. But there's been other times where I've been able to catch something, and like a labral tear on one of my patients 7 years ago out in Grantsville. I was sure it was a labral tear based on my testing and the popping and clicking we're getting. And it came back, no issue on the labrum. So I pull up the images, and I'm like, I think that's a tear right there. And he pulls it up. He's like, you're right, that's torn, and got him in surgery the next week. And just being comfortable. I think people don't even realize you can call your radiologist and chat with them about it. I don't know, do some clinicians just think that door is closed? Like, I said so?
I don't know. I just think you have to have your team. And I think a lot of clinicians are busy.
Yeah.
I get an MRI back, and especially on personal injury cases, but every case, I will write up my report of the MRI, because that's the only thing admissible in court for me, is my opinion.
Right.
I can't testify on the radiologist's opinion. That's his opinion.
Yep.
So I'll take the time to do that, and I'll also, on any injury case, I'll take screenshots of the MRI, and then I'll put it in PowerPoint with arrows and descriptors so I can show the objective evidence. That takes a lot of time, and I think we get busy as clinicians, and we're just like, it's fine, move on. And so I just think there's a lot of not working as a team because of time. But I don't know, maybe there's an intimidation factor, but I've never had a radiologist that wasn't anything but fun to talk with, and you know, that's their world, and so I'm not going into it like, hey, I have training, I'm better than you. No, let's just talk about it. I'm seeing this, and a lot of times they'll say, well, I didn't think it was that important to put that. You know, I used to hit them up about hemangiomas all the time because they wouldn't even report it. I'm like, well, shouldn't we be talking about that? And you know, now I'm pretty comfortable with hemangiomas. I don't need to call them up, but a lot of them are putting it in the reports.
Yeah, that's cool. That's interesting to. I'd never thought about them seeing something and being like, "Hey, I'm trying to not put too much detail."
Well, who are they reading for, in
Right.
your opinion? Who is a radiologist reading for?
For the doctor.
I have my opinion.
Right.
For surgeons, that's who
For
I think they're
surgeons.
reading for.
Yeah.
You talked about your labral tear. All that radiologist really wanted to do is, hey, is this surgical or non-surgical? They don't care. I mean, if there's a tumor or something,
Right.
but most of them aren't writing the reports for a forensic personal injury case. They're writing it, does this guy need surgery or not? So a lot of the littler things they just leave out a lot of times, and I don't think they didn't see it or they're
Right.
incompetent. I think that's just where they're at. So
It makes sense when I write my notes on a physical therapy treatment. I'm not going to say, you know, the ankle moved 2 degrees inward, then 3 degrees outward, and it took, you know, you put what's needed to tell the story as condensed as possible.
and they're just trained to read for surgeons.
Yeah.
A lot of
That
them
makes
are
sense.
emergency room physicians. Like, hey, is this guy having a stroke or not? They
Right.
don't care about the little lipoma, or you know, they use that as an example, but
Right.
they know who they're writing for, and it's, you know, changed a little bit. Like, there's some imaging centers in town. I know Reyes, they have tried to get specific radiologists to read, and they have a chiropractic protocol, which I believe was just set up on, you know, I went in there and came up with a protocol, and I think they started using that as a chiropractic protocol, and then other chiropractors have added to it. So they're trying to make it more for us than just the surgeons, but
That's
you know,
cool.
I think that's what's happening out there. So.
I think that'll be super important, especially with these ligament laxity stuff. The more I've been studying personal injury, realizing how much that impacts recovery time.
Yeah.
Right. Before, I mean, I've been a PT for 8 years, and previously, maybe this makes me look naive, but I was very focused on muscle and joints and less on the ligaments. I mean, if it's torn or something, right? But ligament laxity caused from whiplash injuries, it's been very educational to dive into that detail. Do you do?
Yeah, ligament damage. I don't ever want to call it ligament laxity. I don't like the term laxity.
I've just heard ligament laxity studies.
When
but
we
what do
hit
you call it?
when we hit what they call alteration of motion segment integrity, I mean, we're talking catastrophic failure of ligaments, complete tearing.
Right.
Laxity makes it sound like it just went loose, but I mean, you have significant ligament damage, and there's some really good research that shows that you can't ever restore or fix that, but you can manage it. But from mine and your perspective, the management, the only thing they showed that was effective was increasing motion of the affected joint, getting movement in there.
Okay.
That's what we do. That's
Right.
that's our job.
Yeah.
You know, the surgery doesn't restore ligament, but you know, maybe you know, bigger ligaments you can do. You'd want to have surgery if you have an
Right.
ACL tear, right? I wouldn't say just move your knee. But the spinal ligaments, the only surgery is fusion. That's not going to
And
help.
That's terrible.
Yeah, medicine, steroid injections, all this stuff decreases the function of the ligament, and moving it and keeping it active is important. So what me and you are doing in our professions, that is the management, not a cure, but it's a management for this
Right.
ligament damage. And so that's crucial.
But that's also why it can take so long, right? It's not come in and do surgery once. It's come and work with a chiropractor several times a week, and we're talking months.
Yeah,
Some of
and
these-
then typically at the end of a few months, patients are feeling good, symptoms are gone. release them from care, you're at MMI and you're going to need future care, and then they get busy and don't come, and then their neck hurts again because it's a permanent injury. That really, we need to get that neck moving. That's what the evidence shows, is move that neck. I got one of your stickers today. It said, like, movement is life. I don't know if that's what it said, but something along those lines. Especially for ligament damage patients, movement is key.
That's cool. I hadn't had anybody say it that way before, so I really like that. What are your thoughts then on PRP? Is that help, or stem cell, is that helping these ligaments or not doing much?
There's a lot of talk on that, and I might not be up to date on the literature, and I don't know what's going on. So I'm probably not best. I think at some point that may be the answer for a lot of this ligament damage. But when you have your ligaments torn, you lose the reflexive control those ligaments had on the muscles. The gap junction in those cells is torn, lost. And I have never seen a study show that that can be restored through any treatment. But that would be really fascinating if you do a stem cell injection and you're starting to get that ligamentous reflexive control of muscles restored. Maybe someday. And maybe it's out there. I'm just not an expert on that area. Maybe it's there.
Yeah. I've just seen a lot more with PRP and stem cell coming up. I like that thought, though, where we need to learn more, right? It's going to take some time. But if it's helping the tissue heal, that doesn't necessarily mean it restored the function of the tissue, right?
Sure.
And
I mean, the ligament damage, you
can't practice flex that ligament like you could a muscle, right?
You get the scar tissue, which, instead of having nice wave-like ligaments, now you got a bowl of spaghetti, you get adhesions, you get fat cells that form inside of that, you get all sorts of inflammatory plaques. You get just a mess. And I don't know that a stem cell injection is going to fix that scar tissue. I'm sure it has improvements, but if you haven't looked into and done a lot of research on the reflexive control ligaments have on muscles and how once that's torn, it doesn't come back, I tend to believe that would be very difficult for a stem cell injection to restore that. But that's also really hard to study. Like, we can do the x-rays and show, okay, look, the motion has been restored with stem cell injections, but do we have that, that cellular control of the muscles restored? I don't know the best way to ever show that again, but I think that'd be hard. I think it'd be a better management doing the stem cells, but I think you're still living with a permanent injury.
Yeah, and earlier would be better than later, right? Once the scar tissue set in, but maybe it helps the scars. I'd be interested to see if they're able to start doing studies, microscopic studies, to actually see what's happening on the...
Yeah, that'd be fascinating. But first you have to get people that are doing the injections to even get on board with these type of injuries, and that's not been easy to do either. Yeah,
that has been difficult. I don't know. I just want to build, the path, the recovery for people based on what they need. And sometimes it feels like, well, what can I charge more for with a PRP or whatever? Or what can I don't know, surgery and medication and stuff. And sometimes surgery is needed. Don't get me wrong, but what we do, like you said, movement is that medicine that people need. And it's a management thing, not a full-blown healing, I guess.
Spine management, maybe even extremity management is not a common thing. Diabetes management is very common in healthcare. If you have hypertension, we're going to manage that. If you have a lot of different conditions, management is very common.
Right.
You start talking management of spine, it's almost like you don't know what you're talking about. But a lot of spine injuries are permanent injuries that need management. Hopefully high quality of life and not daily visits or even weekly, but management is crucial.
How do you educate your patients to help them understand where they're at on that and what's the right, I guess, long-term management? I like the comparison to diabetes. My buddy's got diabetes and he's very big into helping people learn how to manage it. How do you teach people manage your spine health, what they can do on their own and with you?
So for me, I think it's really important that we understand where patients are coming from. They might love you as a physical therapist and me as a chiropractor, but time and money are crucial. They don't want to come see me every month every other month, every week.
Right.
And so if we can educate them on things they can do on their own. But a lot of, mechanical spinal problems come from your job, your posture, your mattress, your hobbies, your injuries, your stress, your diet, your life, all these different things. So sometimes they need us because there's just so many things they can't control. But trying to educate them on all the ways they can work better, lift better, sit better, home care exercises, stretching, eating healthy, reducing stress in their life. So helping educate on that, but then just kind of setting the terms that, hey, you're not having to take a pill every day for your spinal, issues, but you might have to come see me every couple months. And if you get lazy on doing your home care stuff, you might have to come see me a little more, and you'll have good days and bad days, but just trying to, I think, see it from their perspective of they don't want to do it. I don't want to go see a chiropractor, every week, but.
Yeah. When I've been injured, like I injured my knee during the summer, I have to go to a physical therapist. I'm like, how do people fit this in their schedule?
Sure. Yeah.
I'm busy. I can't just go twice a week for an hour. It really opens your eyes when you have to deal with it yourself. I like that you mentioned every aspect of their life, right? Their sleeping posture, their work posture, and teaching people how to live healthier on their own, and then supplement it with treatment from physical therapy or chiropractic care, right? Getting people where they can be as independent as possible, but also understand sometimes you need to see your chiropractor once a month. And my mom goes to a massage therapist for 90 minutes every month. That's okay. It's okay to have that sort of management plan.
Well, and every body responds differently.
Yeah.
Some may not respond at all to chiropractic, but therapeutic exercises and different massages or different things might work for them. And
right.
It kind of just depends on the injury and the patient. Yeah. Not every injury responds to the same type of treatment.
Yeah. Well, I'm a big fan of that.
Yeah.
I call it our art, right? I think of myself as a musician in the physical therapy sense. That'll ring with you, right?
Yeah.
What do you play, by the way?
I play the bass.
Bass?
Yeah.
Nice. So I played violin growing up. And so my instrument, my music of physical therapy is this style. And it might not be in harmony with this patient. So let's get you with a different PT. That's not in harmony with you. Let's get you with a chiropractor. That's not in harmony. Let's go to a massage therapist, right? It's okay that people need to find the right PT or chiropractor massage therapist that is in harmony with them.
Yeah.
I don't know.
Yeah, that's a good example.
Maybe that's just how I justify my style of treatment, but I feel like I harmonize with certain people better than others. Have you seen that with yourself?
Oh yeah, all the time. And I'll have patients come in saying, I went to the chiropractor down the street, it didn't work for me. And I'm sure I've had patients that left here and went down the street and said, that just didn't work for me. And I tell patients, you have to find the chiropractor that works for you, that helps you, that gives you the kind of care you want. There's different styles of, treatment. And so I think same like I talked earlier, any profession, find the dentist that works for you, find the chiropractor, the physical therapist, and sometimes it takes time to find the right fit.
Yeah, I found my dentist, by the way. He moved clinics. I went there and I was with some other guy. I was like, this is not okay.
This is not okay.
So I canceled my future appointments. I'm moving to wherever he's at.
Nice.
Like, you got to find that one that fits you. Well, before we close up, this has been super educational. I think hopefully people can find they fit with you when you're the right chiropractor, but even if you're not the perfect one for them, if they're in a car crash, they got to see you because you're that expert who can build up their case and support that. That's just what I'm hearing. Tell me where I'm wrong. What would you recommend when people are in a car crash and they're looking for a chiropractor?
That's a tricky one. Because you have two aspects to be worried about there. Okay. One, your health, and that's the most important. And I think most chiropractors are competent and are going to help you with your health. But you also have a legal case. Yeah. And if it's not documented well, and I always tell patients, day one, I don't know what your final results are. We haven't gotten MRI, we haven't done x-rays. I don't know if you have permanent injuries. But if I don't document it day one, like you have permanent injuries, if you need care for the rest of your life and you needed a cervical fusion, you need all this stuff, I could be ruining your case so the attorney can't get you that settlement. So 20 years from now, you're still paying out of pocket to go see a provider somewhere. So trying to find one that focuses on it is important. But the problem is, because there's more money in personal injury than other aspects, they all focus on it. Everyone does. So a lot of times looking at someone's curriculum vitae or the CV, seeing what kind of training they have, on there should be listed their depositions, their testifying in trial, word of mouth, talking to attorneys. A lot of attorneys know which chiropractors are going to screw up the case and which aren't. Yep. So sometimes just talking to a few attorneys, even if you don't sign up with the attorney or an attorney in general, you could ask them
where to go.
Where to go. Yeah. It's tricky out there.
I think that's super important because they can screw up the case. And yes, your health is most important. However, if you get cancer and you don't have health insurance and you lose your house and you lose this, that, the other, right? Same thing with a car crash. Car crashes can be devastating financially, right? If you screw up the case and you don't have a good lawyer, or when lawyers are needed, you have a chiropractor or PT who's writing MMI on day 3, right? Like it can be devastating and ruin your life. And like you said, you need that management for your whole life. But they're going to close this case now and give you a certain amount of money. That means you're paying yourself whatever they didn't give you now for additional care for the next 30, 40, 50 years.
Yeah, and there'll be a lot of cases that end up that way to attorneys, and the attorneys can't settle it. They have no objective evidence. None of it makes sense. And so that's why I'll do a lot of independent medical exams. The attorneys will refer them to me so I can look at the imaging. If it hasn't been done, get the imaging, show the objective injury, explain the causation, explain why this was related to the accident, and then move forward with an impairment rating and future care plans. So if the case has been managed wrong, there's ways to try to fix it. It's never the best. The best would be to have it managed right from the beginning, but cleaning up the case at the end is something I've done hundreds of times for attorneys.
Well, I think that's super helpful, valuable for everybody to have access to that. What is the best way for them to contact you? Your website, phone numbers, how do people find you?
Yeah, ClaytonChiro.com is the website. Phone number is 801-621-1668. Especially for anyone in an injury case, I have a podcast. It's called The Forensic Chiropractor. I think of it as the world's most boring podcast, unless you're a personal injury attorney. It's boring. You're going to hear evidence and research and how I can justify that. I can explain causation and why it was related and whether it's new or old. Let's time date disc injuries on MRI. It's really boring stuff unless you're a personal injury attorney. But if you want to learn more about that stuff, great research articles given there.
Yeah, that's super valuable. I'm going to start listening to that, and because I want to dive into the details.
Awesome.
And improve my charting. There's some different systems and education out there to help physical therapists, chiropractors who want to get more into this. But I'd say a good starting point is just give you a call. Do you mind PTs, chiros calling you saying, hey, where do I go?
Yeah, I don't mind at all. Yeah.
I think that'd be super valuable. Well, thank you for taking so much time helping educate us. Do you mind just ending with the last question, what mint condition means for you?
Yeah, I thought about this because I knew you were going to ask. And when I was a kid, I collected baseball cards, football cards, stuff like that. And,
nice.
We always wanted a mint card, a card in mint condition, and which meant it was brand new. It was just not brand new, but it was condition. It was out of the box. It was perfect. It was set up just the way it was. And I always had this Joe Montana rookie card, and he was my hero as a kid. And I loved Joe Montana, and I got this rookie card, and it was only a few years ago I sent it off to be graded, to get a grade. And, I don't know how low it goes, but 10 is your mint condition. And mine was like a 7 because it was faded and there was this or that issue with it. So as far as healthcare, I kind of think of the word mint like that. Like we want to be out of the package, right? We want to be functioning right. But like I said earlier, your job, your posture, your mattress, your hobbies, your injuries, your life, just everything you do, your diet can alter that. So trying to get that back as best we can, trying to improve all those aspects. So seeing a mental health provider if you need that, going on vacation to get some relaxation, doing your exercises, seeing a physical therapist, getting your mechanics worked out with a chiropractor, trying to get back to what that was supposed to look like when you were knew when you were born.
Right.
Yeah. So
Or-
anyway, that was my thought on it.
I love that. Get yourself in every aspect. You brought up health, like mental health. You brought up physical health, and just living life in that mint level. Yeah. We all get bumps and bruises, but let's do what we can to get back. That's cool. I appreciate it. Well, thanks for so much time. This was great.
Thanks for having me.